Welcome to our Mock Interview Pro series, where today we're diving into the world of nephrology nursing. If you're gearing up for an interview in this rewarding field, you're in the right place. Let's start by exploring how you can effectively communicate complex medical information to patients and their families. Can you think of a time when you had to explain complex medical information to a patient or their family? Interviewers ask this to see how well you can break down complicated details into understandable terms, which is crucial in patient care. Let's consider how you can approach this kind of question. Begin by identifying the specific medical information and why it's complex. Assess the patient's or family's current understanding of the topic. Describe how you simplify the information for them. Encourage questions to make sure they fully grasp the information. Conclude with the outcome and how it positively impacted patient care. Here's an example of how you might answer this question.
During a discussion about dialysis options with a patient's family, I realized the complexity of peritoneal and hemodialysis could be overwhelming. So I started by asking what they already knew. I then used simple language, diagrams, and visual aids to highlight the differences. By encouraging questions, I made sure they felt comfortable and informed, leading to their confidence in decision-making about the treatment.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Nephrology Nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time when you advocated for a patient's needs within the healthcare system. This question helps assess your ability to stand up for patients and ensure they receive the care they deserve. Here's how you can structure your response. Pick a specific instance that highlights your advocacy skills. Clearly describe the patient's needs. Explain the actions you took to address those needs. Share the outcome for the patient after your intervention. Reflect on what you learned from this experience. Let's walk through a sample answer to give you an idea.
I once had a patient with end-stage renal disease who needed a kidney transplant. Noticing they weren't prioritized on the transplant list, I compiled all necessary medical documents and communicated persistently with the transplant team. My advocacy led to the patient being evaluated sooner and eventually added to the list, greatly enhancing their chances of receiving a transplant.
Describe a situation where you provided exceptional care to a patient with chronic kidney disease. This query examines your ability to deliver outstanding care and handle the unique challenges of chronic conditions. Here are some pointers to help you frame your response. Think of a specific patient scenario to discuss. Detail the patient's condition and your role in their care. Focus on the actions you took to provide exceptional care. Highlight the outcome and any lessons learned from the experience. Here's an example to illustrate a strong response.
I once worked with a patient struggling with diet compliance due to stage 4 chronic kidney disease. I educated them about the importance of their diet and crafted a personalized meal plan. As a result, they adhered to it, felt better, and were motivated to continue. This experience reinforced my belief in the power of patient education.
How would you handle a situation where a patient refuses to continue with their treatment plan? This question evaluates your conflict resolution skills and your ability to guide a patient through their concerns. Here's how to effectively address this scenario. Start by listening to the patient's concerns without interrupting. Validate their feelings and empathize with their situation. Provide clear information on the benefits and risks involved. Explore any misconceptions or barriers they might have. Encourage a shared decision-making process to empower them. Now, let's look at how you could structure your answer.
I would begin by listening to the patient's reasons for refusing treatment and validate their feelings. Then I'd explain the benefits of the treatment and address any misconceptions they might have. Finally, I'd encourage a collaborative approach to find a solution that feels right for them.
What would you do if a patient's family disagrees with the prescribed treatment plan? This question assesses your ability to handle ethical dilemmas and work with families to find common ground. Consider these steps when responding to this question. Listen actively to the family's concerns about the treatment plan. Acknowledge their feelings and validate their worries. Offer clear explanations for the treatment's rationale and benefits. Promote a collaborative approach to agree on a satisfying solution. Involve the healthcare team when necessary for additional support. Here's how you might approach your answer.
I'd begin by listening to the family's concerns and show empathy. Then, I would explain the treatment plan thoroughly, focusing on its benefits. If needed, I'd involve the healthcare team to ensure the family feels supported and informed.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.